Hi, Dr. Matt today. Today I want to answer a question that we commonly are getting from our knee pain patients, okay? And this question is, I have knee pain. My knee hurts. Why are you looking at my lower back? Why are you looking at my pelvis? My problem is my knee. And we have to explain to people that your problem is not just your knee. You see, we've been trained to take care of the pain, the symptoms. This is just how we've been raised in our society. This is what medicine tells us to do. And what we find today is that the cause of the knee pain typically isn't the knee itself unless there's been a traumatic injury directly to that joint. And many people that we see don't have the traumatic injury specifically to that joint. Or if somebody has an injury to that joint, it's a result of a poor mechanical issue that was going on prior to that injury, and it was never corrected to begin with. So, what does all this mean? I'm going to explain it to you really simply here, okay? So, your knee should be tracking properly. We have muscles that run from our knee when it's not tracking properly. These muscles around our knee, our hamstrings, our quads, our IT bands become tight. They go into spasm in order to support the knee properly, okay? These muscles also attach up here into the pelvic area. So your IT band will attach down at the bottom here, down by your knee, and it'll come all the way up here into your pelvis. Some of you guys may feel it while you're running, a tight IT band, because there's instability within that knee or within the hip itself. Two joints that are stabilized by that IT band. But then what happens is muscles that we have in and around the pelvis then begin to compensate because you're changing your biomechanics because that knee is hurting, okay? So we start to change what we're doing and our abdominal area becomes very weak. So we get weak abs. We also get weak glutes, also the butt muscle, okay? And on the opposing side of that, if we have a weakness, there's got to be muscles that make up for that weakness. And those muscles are tight hip flexors and tight low back muscles. So, people with knee pain, many times they're going to have a tight low back and they're going to have tight hip flexors, or they will have weak abs and weak glutes. And it's not an or, it's they will have both, because this here is actually called lower cross syndrome. And if you have knee pain and you're not evaluating to see if you have lower cross syndrome going on within the muscles of that lower back, then that knee pain is going to be coming back. It's just a matter of time, quite honestly. And then we'll also start to see degeneration happening in these joints of the lower spine, and then low back pain begins to develop. So why do we check everything? Because we're thorough in what we do and want to make sure we're preventing any other arthritis that begins to develop in the body. So hopefully that answers your question. If you know somebody that's having knee pain or needs some help, be sure to let them know that this video is out there. Share this with them, and they can also find us at on the web at lifeworkskc.com.